We came back to women and babies because of the care, because the technology is state of the art, really prepared all around for anything that would come, whether good or bad.
I went into labor a Saturday evening and we went into women's and babies. We didn't know what we were having, which was fun. So we got there and everything went well. We got in and I got my epidural and then they broke my water, and about 2 hours later, my daughter Anna Grace was born.
Yeah, 1:30 delivery, and then it was about 4:30 when we moved into the new room, to the recovery room, and finally went to sleep around 5 o'clock.
I walked into Katie's room, it was around 7:30 in the morning, introduced myself, told her that I would be taking care of her for the day, and went ahead to do the assessment, and took notice that when I was doing the assessment, her bleeding seemed to be a little bit heavier than normal. So, of course, I wanted to go get some additional equipment and stuff so I'd have it in the room just in case we ended up with a postpartum hemorrhage. So I told her I would be right back.
I remember waking up, going across and telling her, you know, I just want to sleep some more and, you know, not call people quite yet, washing my face, and then that was pretty much it, I believe, from there, yeah.
He looked at me kind of funny and all of a sudden he just passed out on the floor and had a seizure, so I started screaming.
Coming down the hall, I heard her hollering, "I need help, I need help." And when I got into the room, she said, "Please help my husband, he's on the floor." I just kind of called out, "I'm in room 24 and I need extra help now."
Nurses came in and took my daughter out and took me out of the room.
I was out in women's and babies as an adjunct professor. I was actually in the nursery with a few students doing a well baby assessment, and one of the nurses, Carol, came running in and she was like, "I need an airway," and I kind of looked stunned like, "Is it a mom or a baby?" She goes, "No, the dad is down." When I got into the room, Brian was down on the floor having a grand mal seizure. So I called to the nurses. I said, "We're going to probably need some Ativan. We need anesthesia. Let's get some pillows down on the floor." And we were throwing pillows down.
At this point, he still was seizing. So, I mean, we just kept doing the best care that we could to try and get him stable.
They had called EMS, so EMS came down and we got him ready for transport and got him downtown.
We had to call out to Katie's physician to come in, and she ended up with a hemorrhage, so we had to take care of her as well. So the charge nurse helped me to kind of get Katie settled, and I felt really bad. I mean, at that point, I was trying to spend as much time with Katie as what I could.
Things went in and out. I was so sedated, as I remember, I think after that the nurses said I completely wiped out the stock of the whatever drugs or sedatives that they had in stock there.
We actually met to do like a little huddle to make sure that what we did was appropriate. So I think it just kind of pulled everything together. There was teamwork, there was education, there was teaching, there was leadership. It just made you feel good.
And just knowing that we had communication, whether these nurses knew me or not, they all knew that we were all going to help each other because we all wore that Lancaster General sign. I can honestly tell you, this facility speaks mountains. It really does, just by the actions that happen every day here.
Lancaster General is magnet, and I think everyone pulls together and establishes the 14 forces of magnetism. I mean, it just depends on the individual situation, and I just felt that we displayed quite a few of them that day.
To all the nurses that were there for me and for my husband during the experience that we had when my daughter was born and when my husband dealt with his situation, I just really am thankful for the opportunity to be able to say thank you, because every single one of you went above and beyond. I don't think there was one person that made me feel uncared for in any way. You made me feel like family, and I felt like even though I was surrounded by my own family, I had an extended family with the nurses. So thank you so much for everything that you do on an everyday basis. You probably don't get thanked enough. Thank you very much.
To all the nurses, you were a blessing, even if you don't think you were. You were a tremendous blessing for her, for Anna, just for my whole family, and lastly for myself. We might not have met, but thank you very much.